Pramiracetam has been shown to boost overall cognition, focus, working and long-term memory, and learning. It's a fat-soluble nootropic in the racetam class of compounds. It was first synthesized by scientists at Park Davis in the late 1970s. It was first tested with Alzheimer's patients, seeing mixed results. The company tried it with major depressive disorder, and they licensed Pramiracetam as an orphan drug to Minarni, who continued the research using it for dementia. In 1991, the company licensed the Pramiracetam to Cambridge Neuroscience Inc. The nootropic was then tested for restoring cognitive function after a stroke or traumatic brain injury. The researchers found that the Pramiracetam was up to 30 times more potent than the original paracetam. In Europe, this nootropic is prescribed for the treatment of dyslexia, ADHD, dementia, and other memory problems. Pramiracetam has gained a reputation in the nootropics community for optimizing cognition. It's a favorite with students and executives for boosting cognition, focus, memory, and recall. Pramiracetam has been shown to significantly increase high-affinity choline uptake in the hippocampus. This action boosts acetylcholine use, and this accounts, at least in part, for Pramiracetam's ability to enhance cognition and memory. Pramiracetam has a profound effect on the synthesis of the neurotransmitter acetylcholine. This is critical for encoding new memories, concentration, cognition, and neuroplasticity. Pramiracetam increases nitric oxide activity in your brain. The nitric oxide acts as a vascular dilator, and this means it relaxes blood vessels, allowing for the freer flow of blood. The increased blood flow delivers more oxygen and nutrients to the brain cells, promoting better learning and memory. Pramiracetam as a nootropic is legal, and it's sold in many parts of the world as a prescription drug. Pramistar, Pramir, and Renin. In the United States, Pramiracetam is sold as an over-the-counter research compound, and it's readily available to the nootropics community. Pramiracetam shares a unique quality with coolracetam in the racetam class of nootropics. Its primary method of action is boosting the high-affinity choline uptake in the hippocampus. This helps increase the acetylcholine synthesis, and its function helps the overall cognition, improve memory and recall, learning and focus. Pramiracetam has been shown in the lab to not directly influence GABA, dopamine, norepinephrine or serotonin in the brain. So don't look to Pramiracetam to correct mood and anxiety issues. Pramiracetam does increase nitric oxide activity in the brain, helping to increase the cerebral circulation, and this improves the efficiency of the brain cells needed for motor function, learning, and visual function. Several animal and human studies show that Pramiracetam has a significant impact on memory. In this animal study, researchers administered Pramiracetam to rats in a one-trial test. This is significant because it proves that Pramiracetam works right off the gate. It doesn't take multiple doses or a couple of weeks to build up in your system. It works on the first day that you use it. The scientists found that the rats had a significant improvement in retention by using the Pramiracetam, and the effects lasted for 24 hours. Several studies show that the Pramiracetam boosts the high-affinity choline uptake in the hippocampus. The increase in the acetylcholine makes more of this neurotransmitter available to the neurons for cognitive processing. This increases attention, mental clarity, memory, and verbal skills. High-affinity choline uptake is the uptake of choline in the synapses needed for the acetylcholine synthesis. This is a critical link in the chain of events needed for your brain to make acetylcholine. Studies with Pramiracetam and other racetam nootropic compounds like coolracetam show that boosting the high-affinity choline uptake increases memory, and it even restores memory function in parts of the brain that have been damaged. As we get older, our brain chemistry and our metabolism changes, and it seems these changes are affecting younger and younger people. Recall, reaction time, and learning capacity decline. Acetylcholine levels decline. Acetylcholine receptors decline. Cerebral blood flow declines, and nitric oxide levels decline. All of these changes are contributing factors to age-related cognitive decline. Early signs of these effects can be seen in poor decision-making, difficulty learning, and even recalling simple things like an important appointment. But even if you're not concerned with the signs of aging, Pramiracetam can still help. The Pramiracetam helps to boost acetylcholine synthesis and use in the brain, and it increases cerebral circulation. As a nootropic, it easily crosses the blood-brain barrier, and since it's fat-soluble, it must be taken with a healthy fat such as unrefined coconut oil or an MCT oil to ensure its absorption. The Pramiracetam increases the amount and the efficiency of acetylcholine by influencing the high-affinity choline uptake system in the brain, and this increases the acetylcholine, and it can have a profound effect on overall cognition and memory. With Pramiracetam, you'll find it easier to focus and learning ability will improve. This increase in the acetylcholine in the hippocampus helps with logic and understanding complex mathematical and technical subjects, if that's your thing. Increased neuroplasticity from more acetylcholine and improved cerebral circulation affects long-term potentiation, so you may find it easier to recall long-forgotten memories. Many users report that taking Pramiracetam quickly gets your brain firing on all cylinders. There's an intense increase in focus and possibly even a boost in confidence. But once you get accustomed to this laser-like focus, the novelty wears off and you become used to being able to focus at will. Pramiracetam is reported to be great for intense, long study sessions, or when you face logical, attention-based tasks where you need sharp focus, like when you're doing a presentation. This nootropic makes burning through tedious, arduous tasks that require a level of sustained focus easier. Others report it improves recall ability, fluidity of thought, and ease of verbal communication and numerical calculations. Researchers working with old Fisher 344 rats found that the aged rats had a consistently different EEG profile from the younger rats. They found slow brainwaves were present in both the frontal cerebral cortex and the hippocampus. Theta brainwave activity was missing altogether, but was dominant in the brains of the young rats. Theta brainwaves are associated with creativity, integrative experiences, and the relief from trauma. Theta brainwaves are commonly experienced by meditators. An aha moment is a burst of a theta brainwave. The research team found that the Pramiracetam normalized brainwave activity in the old rats. And even more interesting was that the older sibling, Piracetam, did not produce this effect on the brainwaves, and the tolerance to Piracetam was also a problem. While it hasn't been proven in the lab, this study shows that Pramiracetam could be of benefit to the older generation looking to improve cognitive function. Researchers in Italy investigated Pramiracetam's effect on memory and memory training by a therapist. Types of memory measured were objective memory and metamemory performance. Metamemory is both the inner knowledge of one's own memories combined with the process for formulating new memories with no inner knowledge. 35 healthy volunteers were chosen with an average age of 64 years. 10 subjects received memory training only. 8 received Pramiracetam. 10 received both memory training and Pramiracetam, and the control group received nothing. Results of the study showed that those receiving both memory training and the Pramiracetam experienced a significant improvement in memory, followed by the Pramiracetam group. The memory training only group and the control group scored the lowest. The research team concluded that Pramiracetam significantly improves memory, and the addition of memory training to Pramiracetam has an even more profound effect on both types of memory measured. A double-blind, placebo-controlled study worked with young males who suffered cognition problems due to brain injuries. The men had problems with memory and recall. One group received 400 milligrams of Pramiracetam daily for 18 months, and the other group a placebo. Memory was measured during the trial and for 1 month after the Pramiracetam was discontinued. The researchers found that the Pramiracetam produced a significant improvement in cognition, memory, and recall. Recommended Pramiracetam dose is 250 to 400 milligrams up to 3 times per day. 1 Pramiracetam dose in the morning and 1 in the early afternoon, and if you're doing a third dose later in the afternoon. Pramiracetam is fat soluble, so for the best results take it with a high quality fat like a tablespoon of extra virgin, cold pressed, unrefined coconut oil, MCT oil or olive oil. If you don't take the Pramiracetam with supplemental fat, don't expect much of an improvement in cognition. Pramiracetam is one of the 2 racetams, the other is coolracetam, that has a profound effect on high-affinity choline uptake. This means it can help your brain make more acetylcholine and boost the use of acetylcholine. Acetylcholine is synthesized from the available choline that's in your brain. This means for best results you should also stack Pramiracetam with supplemental choline, such as alpha-glycerylphosphocholine or CDP choline. Do not try to take Pramiracetam sublingually, as it will burn the lining of your mouth. Pramiracetam is non-toxic, so it's considered well tolerated and safe. As with all the racetams, Pramiracetam can cause a headache because it boosts the use of acetylcholine in your brain. Therefore, you should be supplementing with precursor choline sources such as alpha-glycerylphosphocholine or CDP choline. Many users also find that taking Pramiracetam with a choline supplement boosts the effect with the improved memory and the cognition, and this is supported in several research studies. Some users report that the Pramiracetam blunts their emotions. Decisions when it comes to life and work issues are logic-based rather than emotional. This can be good or bad depending on the situation, of course. You could call it emotional objectivity. Pramiracetam is especially helpful to those who are suffering from age-related cognitive decline. It boosts high-affinity choline uptake, which means more acetylcholine is available for your brain, providing a significant improvement in cognition and memory. The Pramiracetam is also particularly useful to students and executives who want to boost cognition, focus, learning, and memory. Pramiracetam is fat-soluble, so it should be taken with a high-quality fat like coconut oil, olive oil, or MCT oil. You should use Pramiracetam with a choline supplement like alpha-GPC or CDP choline. And you can safely boost the daily intake of Pramiracetam up to 1,500 milligrams if needed. However, most find that a lower dose is more effective.